Blood phobia, hemophobia, when red turns to fear. Introduction. Hey there, welcome back to the channel. If you're new here, we explore the fascinating world of human fears and phobias. If you enjoy this content, make sure to hit that subscribe button and notification bell so you don't miss any future videos. Today, we're diving deep into a fear that affects millions of people worldwide: hemophobia, or the fear of blood. Have you ever felt lightheaded at the sight of blood? Perhaps you've had to look away during a medical scene in a movie, or maybe you've even fainted during a blood test. If so, you're not alone. Hemophobia is one of the most common specific phobias, affecting approximately 3 to 4% of the population. But what exactly causes this fear, and how can those affected overcome it? Let's explore. What is hemophobia? Hemophobia is the intense, irrational fear of blood, whether it's your own blood or someone else's. This phobia can manifest in various ways, from mild anxiety to severe panic attacks and fainting episodes. What makes hemophobia particularly interesting is that it's one of the few phobias that can trigger a vasovagal response, a sudden drop in heart rate and blood pressure that can lead to fainting. Sarah from Boston describes her experience. "The first time I fainted at the sight of blood was during a high school biology class. We were watching a video of a surgery and suddenly the room started spinning. Next thing I knew, I was on the floor with my classmates staring at me. It was humiliating, and since then, I've gone to extreme lengths to avoid seeing blood." The unique physiological response. Unlike most phobias that trigger the fight-or-flight response with increased heart rate and blood pressure, hemophobia often causes what's called a biphasic response. Initially, there's a brief increase in heart rate and blood pressure, followed by a sudden drop, which is what leads to dizziness and fainting. Dr. Michael Reynolds, a psychologist from the University of Chicago, specializing in anxiety disorders, explains, "This vasovagal syncope, or fainting response, is actually a primitive reflex that might have evolved as a survival mechanism. When our ancestors were injured and bleeding, this drop in blood pressure could have reduced further blood loss and increased chances of survival." Real-life impact. For 32-year-old Jason from Denver, hemophobia has significantly impacted his life choices. "I wanted to become a doctor since I was a kid, but my fear of blood made that impossible. I can't even take my daughter to get her vaccinations. My wife has to do it. I've missed out on so many experiences because of this fear." Hemophobia can affect daily life in numerous ways. 1. Avoiding medical care, including necessary procedures and checkups. 2. Inability to help in emergency situations. 3. Limitations in career choices. 4. Restrictions in recreational activities that might involve injury. 5. Social embarrassment and anxiety in situations where blood might be present, the origins of blood fear. So where does this fear come from? Like many phobias, hemophobia can develop through various pathways. Traumatic experiences. Many cases of hemophobia can be traced back to a traumatic experience involving blood. Lisa from Seattle shares her story. "When I was 8, I witnessed my father cut himself badly while working in the garage. There was blood everywhere, and he needed emergency surgery. 20 years later, I still can't look at blood without feeling like I'm right back in that garage, terrified and helpless." Observational learning. Sometimes the fear is learned by observing others' reactions. Children are particularly susceptible to picking up fears from their parents or other significant figures in their lives. "My mother would always faint at the sight of blood," explains Mark from Atlanta. "Growing up, I learned that blood was something to fear. Whenever I got hurt as a kid, her panic would make the situation so much worse. I internalized that response, and now I have the same reaction she did." Evolutionary predisposition. Some researchers suggest we might be biologically predisposed to fear blood. Blood outside the body often signaled danger throughout human evolution. It meant injury, predators, or disease. Cultural and media influences. Horror movies, graphic news coverage, and other media can reinforce the association between blood and danger or fear. The cultural symbolism of blood, often connected with death, violence, or danger, can further strengthen this phobia. The cycle of fear. What makes hemophobia particularly challenging is the self-reinforcing cycle it creates. The initial fear triggers physical symptoms, which then become frightening themselves, creating a feedback loop of anxiety. The typical cycle looks like this. 1. Exposure to blood, seeing it, thinking about it, or anticipating it. 2. Initial anxiety response, increased heart rate, sweating. 3. Vasovagal response begins, blood pressure drops. 4. Physical symptoms appear, dizziness, nausea, tunnel vision. 5. Fear of fainting or losing control intensifies. 6. Complete avoidance behavior develops. 7th, reinforcement of the phobia. Beyond the physical, psychological aspects. For many with hemophobia, the fear goes beyond just the physical reaction. There are often deeper psychological components at play. Loss of control. For 27-year-old Emily from Chicago, the worst part isn't the sight of blood itself. What terrifies me most is the feeling of losing control of my body. When I start to feel lightheaded, I panic because I know what's coming and I can't stop it. Symbolic associations. Blood can carry powerful symbolic meanings. It represents vulnerability, mortality, and the fragility of human life. For some, seeing blood forces a confrontation with their own mortality, something many people go to great lengths to avoid thinking about. Contamination fears. In our post-pandemic world, fears about contamination have intensified. Blood can trigger concerns about disease transmission, particularly in those already predisposed to contamination fears or OCD. Real-world challenges. Let's explore some everyday situations that can become challenging for those with hemophobia. Medical settings. For 45-year-old Robert from Phoenix, necessary medical care becomes a battle. I've delayed getting my cholesterol checked for 3 years because I can't handle the blood draw. I know it's irrational, it's just a tiny needle, but the thought of seeing my blood in those vials makes me feel like I'm going to pass out. Parenting challenges. Parenting with hemophobia presents unique difficulties. Children get cuts and scrapes regularly, and a parent's reaction can significantly impact how a child processes these minor injuries. Amanda from Portland shares, "When my son fell off his bike and cut his knee, I had to fight through my panic to help him. I didn't want him to see how terrified I was because I didn't want to pass this fear on to him. I had to pretend to be calm while feeling like I might collapse." Relationship dynamics. Hemophobia can affect relationships in unexpected ways. Partners may need to take on responsibilities the phobic person avoids, from handling injuries to managing medical appointments. "My husband has had to become the designated boo-boo handler in our house," says Melissa from Austin. "He's understanding, but sometimes I feel guilty that this responsibility always falls on him." Treatment approaches. Overcoming the fear. The good news is that hemophobia is highly treatable. Here are the most effective approaches. Cognitive behavioral therapy, CBT. CBT helps individuals identify and challenge irrational thoughts about blood while developing healthier responses. A therapist might help someone reframe thoughts like, "I will definitely faint if I see blood," to, "I might feel uncomfortable, but I have strategies to manage that feeling." Exposure therapy. Gradual exposure to blood-related stimuli in a controlled environment can help desensitize the fear response. This might start with looking at cartoon images of blood, progressing to realistic photos, videos, and eventually real-life situations. Dr. Reynolds explains, "We create a hierarchy of feared situations, starting with the least anxiety-provoking and gradually working up to more challenging scenarios. The key is that the person stays in each situation long enough for their anxiety to naturally decrease, teaching the brain that blood isn't actually dangerous." Applied tension technique. This specific technique was developed especially for blood phobia to counter the drop in blood pressure that leads to fainting. We teach patients to tense the muscles in their arms, torso, and legs for about 10 to 15 seconds, then release the tension but not completely relax, and repeat this cycle, explains Dr. Reynolds. This helps maintain blood pressure and prevents fainting. It's remarkably effective when practiced regularly. Medication options. While medication isn't typically the first-line treatment for specific phobias, Beta blockers can sometimes help manage the physical symptoms of anxiety in specific situations, like before a scheduled blood test. Success stories. Overcoming hemophobia. David from San Francisco shares his journey. I couldn't even watch medical shows on TV without feeling faint. After 6 months of CBT and exposure therapy, I can now donate blood regularly. It wasn't easy. There were sessions where I thought I couldn't go through with it, but the gradual approach really worked. The first time I successfully donated blood without any anxiety was one of the proudest moments of my life. Jennifer from Miami found success through virtual reality therapy. My therapist used VR to simulate medical environments with increasing amounts of blood present. Because I knew it wasn't real, I could practice my coping techniques without the full panic response. Eventually, we transitioned to real-world situations, and I was much better prepared. Self-help strategies. If you're dealing with hemophobia, here are some strategies you can implement on your own. Learn the applied tension technique. Practice tensing your large muscle groups for about 10 to 15 seconds, then releasing slightly, not completely relaxing, for 20 to 30 seconds and repeating. This can help prevent the blood pressure drop that leads to fainting. Develop a coping mantra. Create a phrase to repeat when confronted with blood, such as, "This is just my anxiety and it will pass," or "I am safe and in control." Use distraction techniques. While not a long-term solution, tactical distraction can help in unavoidable situations. Counting backward from 100 by sevens, describing objects in the room in detail, or engaging in conversation can redirect your focus. Practice relaxation skills. Deep breathing, progressive muscle relaxation, and mindfulness meditation can help manage the initial anxiety response before it triggers the vasovagal reaction. Gradual self-exposure. Create your own hierarchy of blood-related stimuli, starting with what causes minimal anxiety, perhaps cartoon images or the word blood, and gradually working up to more realistic representations. When to seek professional help. While self-help strategies can be effective, professional help is recommended if 1. Your fear significantly impacts your quality of life. 2. You're avoiding necessary medical care. 3. Self-help strategies haven't been effective. 4. You experience severe panic attacks or frequent fainting. 5. The phobia is affecting your relationships or work. The bigger picture, understanding our fears. As we wrap up our exploration of hemophobia, it's worth reflecting on what our fears can teach us about ourselves. Phobias, while challenging, offer windows into our minds and evolutionary history. Dr. Reynolds offers this perspective. Our fears, even the irrational ones, are trying to protect us in some way. Understanding the purpose behind the fear, even if that purpose is no longer relevant in our modern world, can be the first step toward making peace with it. Conclusion. Hemophobia may be common, but it doesn't have to control your life. Whether you're dealing with mild anxiety or severe fear responses to blood, effective treatments and strategies exist to help you overcome this challenge. Remember that progress often isn't linear. Setbacks are a normal part of the journey toward overcoming any phobia. The goal isn't necessarily to eliminate all anxiety about blood, but rather to manage it effectively so it no longer limits your life choices. Thank you so much for watching today's video on hemophobia. If you found this helpful or interesting, please give the video a thumbs up and consider subscribing for more content, exploring the fascinating world of human fears and how to overcome them. Share your experiences or questions in the comments below. Your story might help someone else feeling alone in their struggle. Until next time, take care.